Now we are up trying to look at the next imaging modality, okay, as related to orthopedics, of course. So we'll be looking at what is known as what? Myelography. Myelography. Right? So of course you know that was the spinal cord stuff. So myelography is also known as myelogram. Alright, so it's a specialized imaging test and uses X-rays or CT scans. Okay, are usually combined with contrast dye. The dye is this thing that they're actually injecting here. Okay, why do you need a dye? Because these imaging modalities is usually what? The only things they can actually show very well is bones. So you want to visualize other structures like the ligaments, the tendons, and all of that. So you have to now put in a special dye that could actually what? Make it that those other structures are also clearly labeled out. Okay, so it's often used when MRI is not possible or when more detailed visualization is needed. So myelography is an imaging technique that involves injecting some dye into the cerebrospinal fluid around the spinal cord, you know. So you now do all those fluoroscopy, that's real-time X-rays or CT scans, you know, all those kind of things. So to highlight the spinal cord, the nerve roots, the meninges, the disc, okay, and it will make the abnormality much more visible on imaging. All right. So common use, you know, can be used in all those, you know, accessing the spinal canal narrowing, disc herniation, that is pressing on nerves, tumors or cysts, okay, spinal cord injuries, and unexplained back pains. All right. So procedure is the patient has to actually avoid solid food for several hours. Okay, should take a lot of fluid and should avoid some certain medications which they will properly inform you about. Okay, so during the test you should lie on the table, local anesthesia is applied, contrast dye is injected. This is it. Okay, so after the test, then followed by what? The real-time X-rays or CT scans. So after the test, patient may need to lie flat for several hours just to reduce risks of headache because you have tampered with the cerebrospinal fluid, you know. So they should also drink a lot of fluid to wash out the contrast dye. Okay, so that's what we got.